Hello, I'm Dr. Barnett, one of the physicians at Dallas IVF. We at Dallas IVF commonly see patients who request family balancing, otherwise known as sex selection or gender selection. With family balancing, a couple can balance the number of girls and boys they have in their family. There are many reasons why a couple may choose family balancing. It's a personal decision. We've had some couples that present to us who have 2 or 3 boys in their family already, and they want a girl. We have also had couples who, for religious and cultural reasons, find it important to have at least one boy in their family. In addition, sometimes couples are carriers of genetic diseases that present only in one gender and choose sex selection as a means to prevent having a child with a known genetic abnormality. Sex selection is performed through the laboratory technique of PGS, pre-implantation genetic screening. Through the laboratory process of PGS, individual embryos that are created in an IVF cycle can be screened to determine if they are genetically male or female. Then, only embryos of the desired sex are transferred back into the uterus. Any remaining chromosomally normal embryos that are not transferred can be stored for future use. With the type of PGS performed for family balancing at Dallas IVF, called Array Comparative Genomic Hybridization, or simply Array CGH, we not only test for the sex of the embryo, but also look at all 23 sets of chromosomes. With Array CGH, we can screen for Down syndrome and other chromosomal abnormalities. This comprehensive screening increases the chances for our couples to have a chromosomally healthy child. Here is a short video on how a biopsy is performed on a day 5 embryo known as a blastocyst. With PGS, several of the trophectoderm cells that ultimately become the placenta, are removed for testing. This technique, when properly done with experienced embryologists, does not harm the embryo.
Here you can see the trophectoderm biopsy procedure of a day 5 embryo called a blastocyst. The embryo is hatching out of the zona, or shell. The dotted line demonstrates where the laser will be aiming to separate a few trophectoderm cells from the embryo. The procedure starts by aspirating a few cells from the embryo into the glass pipette, shown on the right side of the screen. As you can see, the cells are beginning to detach from the embryo as the embryologist continues to apply the pulses of the laser. With the combination of the applied laser pulses and mechanical aspiration of the cells, the biopsy will successfully break free from the embryo. These are the biopsied cells from the embryo that will be sent off to the genetics lab for analysis. This completes the trophectoderm biopsy procedure.
Dallas IVF also offers sex selection for couples seeking family balancing who have cryopreserved embryos from past cycles that had not previously been tested. Through this process, available at only a few IVF programs in the country, embryos that have previously been cryopreserved but never tested can now be thawed and tested to determine if they are genetically healthy male or female embryos before being transferred back into the woman. Having physicians and an embryology staff experienced and skilled in pre-implantation genetic screening and family balancing is critical. At Dallas IVF, we have a long history of success with PGS. I'm very proud to say that our practice had the first PGS pregnancy in all of both Dallas and Collin County. Our practice was also the first to offer family balancing in Collin County. We at Dallas IVF are very pleased to offer family balancing to patients from Collin and Dallas County, and to those couples who travel from other parts of Texas and elsewhere in the country that are in need of our services.